Hi, my name is Dr. Kit Langstroth. Welcome to our website. This particular portion is dedicated to giving you vital information that will be the difference between success or failure in dealing with your car accident. Whether this is the first accident you've been in or not, I'm going to be sharing some shocking information with you that is vital to your success, and I really mean that. So let's talk about your symptoms. You can get neck pain that radiates into your shoulder or down the arm, mid-back pain, or back pain that radiates down the leg. These symptoms are usually from a nerve compression or a disc problem. You can get numbness or tingling from an injured nerve, since nerves go to the skin for sensation. Weak muscles can occur from nerve damage as well, since nerves go to the muscles. You can also get headaches from injury to the spine and the neck, and this is quite common. My job is to locate where your pain is coming from to help you fix it. Now, what doctor should you go to? This is so huge. If I knew what I know now, after 23 years of practice, I would have saved myself and my patients a lot of heartache. Now, personally, I want a doctor that could give me competent care with the latest treatments that were best for me while being as conservative as possible. Now, I'm considered a primary doctor, meaning that I can treat you but also send you out for all the appropriate diagnostic tests to other specialists if we have to. It really starts with a good examination to determine what's wrong with you. We'll do a complete neurological and orthopedic exam to determine if certain nerves are injured and see which part of your body has been injured. Diagnostic testing, this is extremely important. If you're having a lot of pain and we don't find out why, then that's as if you have nothing wrong with you, and the insurance company will fight you because they aren't going to pay much if we can't prove the injury. You may feel like you're going to die, but if we can't prove it and document it, then you're going to have a much more difficult time in dealing with your particular case. So this is very important. We know you want to get well, of course you do, but we also have to prove the injury. Now, I personally take movement x-rays through my training and certification in whiplash, and what this is we do x-rays of the neck during flexion and during extension, and we'll pick up excessive movement in the spine, which tells us that you've had damaged ligaments. You can only find damaged ligaments on x-ray when you do the flexion extension studies. We also order special flexion extension MRIs, and this is almost never done in personal injury cases. Most doctors don't even know they exist. This sounds ludicrous, but it really is true. There's new technology now where we can place a person in a position of flexion or extension with their spine while we do the MRI, and this will pick up way more problems with the disc than as if you did it in just a neutral position. So by stressing the disc out, we can actually see more herniations and more bulges when we do a flexion extension MRI. This is where the patients come to us. They've been to other doctors. The doctors will tell them, you know, there's really nothing wrong with you. We haven't found anything on the MRI. We'll send them out for another MRI, flexion extension, and we'll find their problem. We also use only the best radiologists to read your MRIs because some are more highly trained to see why you have the pain, and believe it or not, a poor radiologist can actually miss your problem. You know, this does happen, and it happens quite frequently. Once we have all the information and we know your injuries, we can make better recommendations for you. For example, spinal manipulation is very appropriate for vertebrae in your spine that aren't moving properly or are misaligned, which can be responsible for considerable pain in your body. And we certainly don't want your spine to heal crooked or misaligned. So for example, if a bone's out of place, we want to try to get some alignment in there so that it doesn't heal out of place. We also utilize a very different neck traction device to not only help the discs and nerves in the neck, but it's unique in that it can help straighten the spine and return the normal curve back into the neck as well. So for example, if you have a herniated disc and we use our device to traction out the spine, it can actually suck the disc material back into the center of the disc, and it will relieve a lot of the pressure that the disc may be putting on the nerve. So it's very beneficial for patients that do have disc problems. We utilize massage therapy to help spasms and muscle injury, and it can be very, very important in the recovery of a patient's injury. And we have a wonderful full-scale one-on-one Pilates-based rehabilitation program to improve the core strength of a person's spine. And we also get referrals from orthopedic surgeons because of the unique ability to modify the exercises and movements to each patient's individual needs. Some people are very injured and they can't do certain exercises that a person that may not have as many problems do. So one size does not fit all. This is particularly helpful for those who have had a disc injury and want to avoid surgery. For some people, medication prescribed by a physician can help as long as we try to avoid long-term use, if at all possible. Referrals to specialists, if you have disc damage or nerve compressions that are more severe, can be very appropriate if conservative treatments have limiting effects. The bottom line, we will use conservative proven treatments and graduate up to more invasive treatments only if it's necessary. We will get the proper tests done to find your problem, and we only work with excellent, reputable doctors that genuinely care about you. As far as your care getting paid, in most cases it is covered at no cost to you, and I find that having legal advice by only the best attorneys is appropriate. In other words, a bad attorney can do just as much damage as a doctor who improperly manages your care. So, having a good team of reputable professionals is worth their weight in gold. Please feel free to read this entire page and go to other areas of our website to learn more about us. Thank you.